The Sustainable Development Goals.
Also known as the Global Goals, were approved by the United Nations in 2015 as a global call to action to eradicate poverty, safeguard the environment, and guarantee that by 2030, all people live in peace and prosperity. The SDGs aim to eliminate poverty, hunger, AIDS, and discrimination against women. There are 17 SDGs existing that are interconnected and recognize that actions in one area have an impact on outcomes in others, and that development must strike a harmony between social, economic, and environmental sustainability.
The concept of global health varies depending on the source, but it may be thought of as a translational knowledge of healthcare. Among the most common health problems today are brought by about the pandemic. Due to the current global outbreak of COVID-19, researchers, government leaders, and healthcare professionals realize that they have to know more about handling the spread of the virus, since there are an estimated 5 million deaths across the globe and 44,521 deaths in the Philippines as of November 8, 2021.
Additionally, one of the pandemic's many consequences has been a decrease in our mental health, where according to Forbes, 70% of adolescents are dealing with mental health difficulties right now, and 60% of children and adults do not receive the mental health care they require. Moreover, malnutrition and obesity were some of the most prevalent health issues prior to and during the pandemic. A global study found that pandemic-related lockdowns result in dramatic changes in health behaviors, prompting people all over the world to reduce physical activity and practice unhealthy eating habits.
In relation to this, many global issues in the world, and especially in the Philippines, are still left undiscussed and unresearched. The first of them is non-communicable diseases such as heart disease, cancer, and diabetes, which account for 70% of the world's mortality rate. Second, economic inequality in healthcare access. Despite constant advancements in medicine, communities all across the world continue to lack basic health knowledge and treatment. As a result, there exist health inequalities like high infant death rates, which are frequently linked to the effect of people simply unable to afford healthcare that would otherwise be unavailable. Lastly, environmental factors such as storms, flooding, droughts, and air pollution make it easier for diseases to spread.
The third Sustainable Development Goal aims to ensure healthy lives and promote well-being for all at all ages. The target goals of SDG 3 focus on the reduction and prevention of communicable diseases, promotion of mental health, universal access to reproductive care, education, and quality, affordable medicines, reduction of diseases and deaths by chemicals and pollution, and better early warning systems for global epidemic risks. The fulfillment of the target goals of SDG 3 brings about a healthy population of active individuals, vital in the social, sustainable, economic, and overall development of humanity.
Currently, several projects have been done in order to improve people's lives in impoverished areas. Among these efforts are the installation of water boreholes in Kenya and the allocation of homes to the poor in the Philippines. While these steps do improve the lives of their target communities, there is still more needed to be done. Foremost is in the field of healthcare. More advanced amenities must be given to rural healthcare facilities, allowing them to correctly diagnose and treat patients. Another would be the need to educate the marginalized on the importance of assuring that their children and peers are of sound mind and health.
Through the promotion of SDG 3, the health and well-being of people all over the world will be given further importance. This includes the provision of basic necessities, efficient healthcare systems, and financial risk protection. Along with the universality of healthcare coverage comes the availability of vaccines for the population, an aspect that is important in overcoming and preventing the contraction of certain diseases such as COVID-19. This results in increased development, encompassing cognitive and physical. With this, as one community, let us remain fervent in our desire to act on and fulfill the third Sustainable Development Goal, to foresee a flourishing community as we envision a progressive 2030.